Hi everyone and welcome. I'm Dr. Eric Bunge, a chiropractic physician, and we're presenting a case history on treating long COVID with red light therapies, in particular this V-Light and this Aspen laser. So I have a full suite of red light therapy, bed, panels, deep tissue laser, and V-Lights, and I use them all now for a total of 10 years. And with long COVID, what we need to do is reach deep. And what are we trying to do when we reach deep? We're trying to relieve inflammation, and we're trying to restore mitochondrial function. Together, they were able to reach all the different parts that had long COVID symptoms. And there's many benefits because we can reach the entire central nervous system. We can reach the underside of the brain. We can reach the outside of the brain called the cortex, all in just a few minutes with these sessions. The case history, after one session, she returned immediately and said, "I feel so much better, let's keep doing it." We did it twice a week for 4 weeks, and she was able to return to normal. After those first sessions, she thought of it as being able to put on a set of glasses and everything seemed clearer. She was a writer that had to read and digest and then create reports, so there was a very big problem with early fatigue, memory issues, and brain fog. And of course, she had chronic inflammation, feeling pains, aches, but those in the first week were dramatically improved. By the second week, she was able to start working. The fatigue had died down, and her function had been rejuvenated, and she was able to work and take fewer naps. By the 4th week, she felt she had returned to normal, and so we're very proud of that. How it works is called photobiomodulation, and is a form of physical medicine. And I do practice whole body approaches. The 2 treatments that I did in particular were she was seated in a chair, and we added the A10 intra-nasal unit. And then I got the laser, and first I turned it down and I did the outside of the brain called the cortex, okay, and the sides. And then we turned it up and we did full spine. So the central nervous system has a brain and then a spine, and then the peripheral is everything out. So while we're doing the full spine, we're actually reaching also through the ribs to the lungs, even down the lower ribs, the kidneys, muscle tightness around the neck and shoulders, breathing muscles in the front, low back muscles which were aching and paining, some trigger points. And then, so we were able to, this entire central nervous system and even the peripheral, we're able to reduce this inflammation and restore mitochondrial function, and she started repairing much quicker. In 2 sessions a week, over 4 weeks, we helped a long COVID sufferer with brain fog, chronic pain, fatigue, recover her well-being, and get back to work. Now, the importance of these 2 units is that they are higher wavelengths. In particular, this is an 810 intranasal V-Light, and this is a class 4 Aspen laser. We set the Aspen laser at 10 watts and 40 hertz for the transcranial work, and then we used it at full power for the full spine. The V-Light, you'll have to learn how photobiomodulation works, but what it does is it directs that red light therapy to the base of the brain. Okay? And so she was using this for 25 minutes as I was lasering the rest of her body. The laser treatment can reach the outside. Now, we could have used a gamma headset, but with the laser we were able to do a whole bunch of stuff all at once. So we did the outside of the cortex. There was 800 joules over a few minutes. And then we turned it up and we went down the rest of what you call the central nervous system. So the inside with the V-Light, the outside with the laser set at 10, and then full power we did and worked with the rest of the body. So the central nervous system, the brain, and then the spine, and then also the lungs, because that laser will reach through the ribs. We were able to actually a little bit over the kidneys. In the front, the breathing muscles, anything that was making the neck tight while I was working on her. Not just treating one type of tissue such as the central nervous system, but treating the muscles of respiration, treating through the rib cage and helping with the lungs, the circulatory system that's all there, all the little peripheral nerves. This red light laser was able to help reach all those areas very quickly. It took about 15 minutes with each session and 25 minutes with the Vielight. In one session, she returned immediately saying, "Hey, I noticed the benefit. I could see clearer. I had less fatigue." In 2 weeks, the fatigue had been reduced, and she's able to start working small sessions. By the end of the 4th week, returned to normal. And for those who don't know about mitochondrial dysfunction, that's what sets red light therapy apart. We directly treat mitochondrial dysfunction wherever we aim this laser at, whether it's deep or on the surface, inside or outside. It's going to reduce the inflammation. It's going to restore mitochondrial function so there'll be energy. It's going to provide oxygenation, so it's going to see better supply of oxygen and nutrients to the tissue. And it's going to improve function of the nerves, muscle cells, joint cells, fibroblasts that build collagen. That's why you see all these benefits. So that's been how we treat long COVID with the short answer. Thank you for your attention. So we're just turning this on. It's the Vielight 810 intranasal, and we're demonstrating how we do what we did for the long COVID. So the red light therapy, here you can see the dot. We're going to turn down the power. We're going to work with the outside of the head. The Vielight intranasal unit is helping with the underside of the brain. And then we can turn up the power and we can do all the spine, all the way down. We can lift the shirt up and do the lower spine. That's right, that's right. We can reach all the lungs. Okay, just like your arms hang. You do the frontal lungs. And so this is how we do a long COVID treatment using the Vielight and the Class 4 laser. Thank you.